So we'll do soleus, which runs up basically in that sort of direction, coming from the back of the fibula, running around like that, and then down in onto that insertion, onto the calcaneus. There's a couple of spots where you might needle more regularly laterally, and then up through here, and then there's a medial one as well down here. So the main consideration here is the posterior tibial artery and the tibial nerve, which runs deep, basically straight down the middle of the leg, kind of close to that interosseous membrane. So what you would do here to avoid that is you needle in on a horizontal to the table direction, or perpendicular to that interosseous membrane, so that the needle goes in and it goes in above where that artery and nerve is. So you do that when you needle these bottom ones, and then the top needle here, the top trigger point up here, you push gastroc out of the way, or you could needle through gastroc if you wanted to, but you direct it down towards the back of the fibula. So I'm going to needle the back of the fibula here, and I'll needle laterally here in a horizontal direction. So you might find that you need to free up that lateral head of gastroc first before you needle there. There's a pretty big band there that I'm pushing over. Got that there. So fibula head's here, so down below that. Just going to needle in gently. You okay? Mm-hmm. There's that there. I'm only using a 30 here, but you could use a 40, or even you might need a 50 on some people for this. So in the lateral soleus, again, palpate gastroc, feel the anterior border. Soleus there, and as we said, we needle in on a horizontal direction. So one thing to be aware of with this is how aggressive you are with your needling. Just that sometimes if people have a strong twitch, they'll really sort of contract that muscle and go into deep plantar flexion, which can really shear that needle. So you can get caught out if you needle it aggressively, actually like shearing the needle inside the muscle and actually bending it, which then is obviously going to be more painful and create a bit of tissue damage getting that out as well. So it's that lateral. So needling in on this direction so that, you okay? Mm-hmm.